Hello everyone, and welcome back to our channel. Today, we're diving into the world of medical diagnostics to explore one specific test, the C-Reactive Protein test, commonly known as the CRP test. By the end of this video, you'll understand what a CRP test is, why it's important, under what conditions it's prescribed, what it indicates, and how it's qualitatively performed on a slide. So let's get started. What is CRP? C-Reactive Protein, CRP, is a substance produced by the liver in response to inflammation. It's part of the body's immune response. When there's inflammation in the body, CRP levels in the blood can rise significantly. The CRP test measures the amount of this protein to help detect or monitor conditions that cause inflammation. When is a CRP test prescribed? CRP tests are typically ordered in the following scenarios: infections, to detect serious bacterial infections; chronic inflammatory diseases, such as rheumatoid arthritis or lupus; cardiovascular concerns, to assess the risk of heart disease; post-surgical monitoring, to ensure there's no post-operative infection; symptoms of inflammation, such as fever, pain, swelling, or unexplained fatigue. Doctors rely on CRP tests to gather important information about a patient's health, especially when symptoms suggest an inflammatory process. What does a CRP test show? The results of a CRP test can show high CRP levels, indicate the presence of acute inflammation or infection, and can also suggest chronic inflammatory diseases. Moderate elevation might be seen in conditions like chronic inflammation, autoimmune diseases, or cancers. Low CRP levels typically suggest the absence of significant inflammation, which is generally a good sign. It's important to note that CRP levels alone cannot pinpoint the exact location or cause of inflammation, but provide a crucial clue that further diagnostic testing may be necessary. How is the CRP test performed?
Hey guys, it is Medical Laboratory Learning. Today, we want to run the CRP test. When we open the kit box, we see two control solutions inside, a positive control and a negative control. These controls are used to ensure the kit is working properly. First, I open the negative control solution and I place 1 drop of it in the first circle. Then I place 1 drop of positive control solution in the second circle. I add 1 drop of CRP test solution to both circles and mix them completely with an applicator so that the surface of each circle is completely covered. Remember that this test is based on agglutination. The solution we use for observing agglutination in this test is latex. And since latex is white, the slide we use for this test should be black to allow clear observation of agglutination. After mixing the solutions, we place the slide on a shaker for 1 minute. Then we examine the agglutination under the light. In the first circle, when I place the negative control, no agglutination is observed. However, in the second circle, when I place the positive control, a 3+ agglutination is clearly observed. This indicates that our kit is functioning properly. After we make sure that this kit is working properly, we proceed to perform the test for the patient. After venous blood sampling from the patient and centrifuge it to separate the serum, we place 1 drop of the patient's serum and 1 drop of the CRP solution on the black circle of the slide. We mix them with an applicator completely until the entire black circle is covered. Then we place it on a shaker for 1 minute to mix them completely. After 1 minute, we read the result, and here you can see that no agglutination is observed, indicating that the patient has normal CRP levels and the test result is negative.
Thank you for watching. If you found this video helpful, please like, share, and subscribe to our channel for more informative content. If you have any questions or topics you'd like us to cover, leave a comment below. Stay healthy, and see you in the next video.